So in this video I'm going to talk about the torso, how important it is to actually massage the area between the front of the hip line and the neck. Like the whole upper body on the front side needs to be worked on. It's super important to do that. Anybody that is uncomfortable with that, I do a friction test. So the friction test is basically rubbing over a sheet. On my table at work, we have a sheet and then we have a blanket, and I say, can I do a lymphatic test, a friction test, and I rub over their leg, and I said, can I do a friction test to see how your superficial lymphatic system is working? And what I do is it okay to remove part of the blanket but keep you fully covered with the sheet? And I'm like, oh yeah, no problem. So then I start with the quad and I do a friction test. I basically rub over the quad, say, do you feel heat? And they're like, yeah, almost everybody does feel heat with that. Then I go to the hip line, and it's usually if they're wearing underwear, or if they have tight underwear but they're not wearing underwear at that time, they won't feel much heat at all. I go to the stomach, to the side of the stomach, not right straight on the front, but on the side of the stomach, and I say, do you feel heat here? And sometimes they'll say yes, sometimes they'll say no, it just depends. I'll go to the side of the rib cage, right underneath where the bra sits on them, or underneath the pec line for the guys. Do you feel heat here? 9 times out of 10, they'll say no. Even guys will say no, especially if you have a really tight band that you've been struggling with and having power issues. Then the next thing I'll do is I'll do the top of the chest, not like the breast tissue by any means, but like the top of the chest, and I'll just rub right through here and say, hey, do you feel heat here? And most people do, but the problem is it depends on the blood flow and how tight their bras are, how tight their underwear is, all that stuff. And then I'll say, is it okay if I rub through the center, over the sternum? And they're like, oh yeah, go ahead. Even with women with some like sports bras and stuff, they'll still feel heat or not feel heat. And I'll go through that and say, okay, if you don't feel heat here, guys too are just as bad. That means your fascia, the tissue, the connective tissue is stuck to your rib cage. The reason why it gets stuck to the rib cage is if you have a lymphatic kink, a kink in a garden hose is going to hold fluid below it, it's going to suffocate higher up. So therefore if you have 3 bands on your underwear, that's 3 kink points, 3 kinks in a garden hose. If you have scrubs, for a lot of the nurses and doctors that I work on, that's another kink point because they wear them for 10, 12 hours a day. And then you have a sports bra. Sports bras, or honestly any bra, and I understand the use of them, but I feel like there should be a more comfortable option. I think Negative Underwear has a pretty decent selection. Victoria's Secret does not have a good bra selection at all. So I would wish that they would kind of step up their game with that a little bit more. But anyhow, anytime you have a kink in the garden hose, it's going to suffocate higher up. So then no wonder why everybody has chronic neck and shoulder and stress, everything up here, because those bands holding fluid below it, suffocating higher up. If you have 3 bands on the underwear, waistline would be high-waisted pants or anything like that, and then a bra, that is all holding fluid in your lower body, and then the part that has the least amount of blood flow is the chest, the back of the neck, and the upper back. There's a ton of people that are like, oh, there's my knots. Well, there's knots there because your body's trying to protect it because it doesn't have enough blood flow, so it creates scar tissue in place of that. That's where those dower humps come in with that really forward head posture. So underwear is super important. If you do that friction test like I was talking about before, you basically take the independent parts, top of the quad, move it around, see, can you feel how the quad moves? Go right over the ASIS, the knuckle or the point of the hip, pin the tissue down and rub it. Just go 10 times. By about the 7th to 8th time, the tissues really start to soften and the skin moves more. You're not sliding over it, you're basically pinning it down and then moving it. And then you go to the rib cage, lower rib cage, and I said, has anybody worked on the ribs before? And almost everybody says no, they've never had the ribs touched before. And then there can be a lot of sensitivity to that, closer to the bra line, especially into the armpit. And then I go up to the pec muscle, and I work up through here. I always have both hands. I use my fingertips and I go this way, and I have my hands up over the top of the breast tissue. I never place my hands on the breast tissue at all. It's always over, so that way the client can clearly see everything that I'm doing if they choose to look at it. And so then I'll work all through the upper part through here. Then I'll say, can I work on your sternum? And they're like, yeah, sure, go ahead. So then I work on the sternum muscle through here, or the sternum and the pec muscles that lead to the armpit. And then that usually is very stuck down. It takes a little bit of process. Sometimes you have to do muscle activation of the pec muscle fibers and stimulate that to wake those up. And then I recheck the system. So then what you'll notice is most of everybody will feel more heat quicker. If they didn't feel any heat on the underwear line, what I would do is I say, can I pick up your band? And I'll just basically take one finger, pick up the band just enough, like basically just get my finger underneath of it, and then I'll rub over the front of the hip, and they're like, oh, I can't feel it now. And I said, what's the one thing I did different? Picked up the band. That's all. That's all it takes. Is just basically pick up the band just a little bit to get that blood flow to go through. Double check the ribs again, pec again, sternal line again, and as long as they feel blood flow or the heat, at least a little bit of heat all the way through, I know that I can work on the other side, and I know there's nothing else to do. That means the next thing that I do in the session is then I really flush the hips and legs and the glutes and try to really get range of motion out of that if that's what they're wanting. When I flip them over to the other side, so where they're face down, which we call prone, I start with the shoulders. I start with the delt muscle. The delt muscle holds all of the fluid, holds the power when the infraspinatus and the upper trap is just very, very tender. Then I go through the legs. I start with the hamstrings and then the calves, and I do 3 channels, 1, 2, 3, 1, 2, 3, inside, middle, outside. And I just check for tonicity. I just check for fluid buildup. Most time people are like, oh, that's really tight, or they, when we get to the calf, like I put light pressure, they can't even handle it. So then I basically ask them if they're wearing underwear, can I drape down your glute muscle? So then I grab the underwear and I pull it down in one motion, tuck it, leave it. I don't touch it again. And then I basically have them activate the glute muscles, flush that fluid through there on the 3 ways. There's 3 ways to activate the muscles to get the flow to move between the glute max, medius, and minimus. Recheck. I'll actually, before I do that, I'll stimulate the lower back. So I'll ask them, like, is this tender? Like, oh, that's really tight. By the time I get the glute flushed, I'll recheck it. And then when I go through and flush the leg and everything moves through there, everything gets soft, I recheck the lower back and the back pain's gone. That's what it takes. So if you have synapses, if you have back pain, lower back pain, any point wherever it's on the spine, next to the spine, or across the hip line, you need your whole lymphatic system opened up. If you have swelling in the knee, cramping, weakness in the leg, weakness in the hip, weakness in the core, anything like that, your whole lymphatic system needs to be addressed. If it's upper body issues, shoulder range of motion issues, neck tightness, all that, your whole system needs to be opened up. Because if you have, your body is basically like a big tube, complex tube with a lot of different hoses and pathways to it, you cannot just work the neck and the shoulders and all this and expect to have any real long-term success for your client. You have to work the whole lymphatic system, and it would be nice to know if there's anybody else there that does that in a way that's similar to mine. So, that's what I got.